Okay. In this strip, I think first before rhythm assessment, let's revise the rule or principle of rhythm analysis. If you remember, I told you number one, rate, and rate of both QRS and T. Second, rhythm. And what we are saying, rhythm in terms of feature, both QRS and P rhythm. Just follow P rhythm and QRS. Then P wave. P wave, in P wave you have to assess present or absent, similar or dissimilar. P rhythm we already have described. One before each QRS or more than one before QR. These four things about P always judge in your ECG in relation to P. Then PR interval. And PR interval of every QRS, not just 1, 2, 3, no. Every QRS and P should be checked. What's the status? Is it same? It is prolonged or same? It is progressively prolonging, variable, whatever the short, whatever the PR is. And lastly, QRS duration in every QRS. So these 5 points are very important when you are assessing rhythm. Always make yourself habitual of doing. Whenever you are asked to assess rhythm, leave aside the diagnosis. Just calculate rate, QRS rate, P rate, rhythm, QRS rhythm, P rhythm, P, present, absent, similar, dissimilar, one before each QRS or more than one before QR. Then PR interval of every complex and QRS every complex. Now come to this ECG and see what's happening here in this ECG. Let's come to the ECG. Let's look at the first. Rate. Rate is around 40 if you average it out, because rhythm is not regular. So you can't apply that formula of rate assessment. What you have to do, you have to count a 6-second strip. 6-second strip means you have to count every 5 large box and mark it 1, 2, 3, 4, 5, 6. That means total 6 5s are 30 large squares. In 30 large square, there is how many QRS? You have to count that. Usually here we have 4.5 or 5. So it's rate around 45 to 50. So rate is clear. Rhythm, I already told you. Rhythm is irregular. So whenever you have an irregular rhythm, it can't be complete heart valve. There is something more than that or something different from that. Now you have to look for P. P present, similar. In first and second complex, apparently it's looking 1 P before each QRS. But you have to follow the P rhythm. Just follow what's happening with the P. If you just carefully look at the T of first QRS, you will find a double hump, isn't it? And just try to match it with your preceding and succeeding P. You will find that this one is also P. The second hump of the T is actually a P, which isn't clear because it's within T. Then just follow. Next P is again within T of the second QRS. Fourth P is clear. But fourth P is without QRS, isn't it? You don't have any QRS after P. After a long PR, you found a broad QRS. Then again, this third QRS, P, distally is showing another hump. This is again P. A hump after broad QRS, T, and distal part of the T is showing you a hump. After that first broad QRS, this is also P. Because if you just follow the P, you will find that this is also P. Then you have a P with QRS very far away from it. A broad QRS. And now the P is separating clearly from the T. And that gives you an idea that whatever you are considering P was P, because it's following that rhythm. Then you found another P before QRS. And now your QRS is again different. Similar to that, with the QRS you started. First two QRS and this fifth QRS is similar. So this is a condition where your patient is in between third and second degree, I think, with picking this P and QRS. Because what's happening, in first two beats, you may have a 2:1 possible. And now I'm agreeing. Then your P haven't found a QRS. And this QRS, this broad QRS, is generated from ventricle. It's not for node because it's broad and bizarre. So that's why your P and QRS have no relation. So in these two beats, that is third and fourth, your patient developed complete heart block with escape ventricular rate originating from the ventricle, because that's why it's different from the native. Native, your QRS is narrow because this QRS is coming from bundle of His and going down. And again, after that first, second, third, fourth, fifth beat, in which you have P and R looking related, you again have a P, I think, within T, because your T is again is not clear cut, peaked, forming a single cone. It's forming again a hump. So I think one of the P is within the distal limb of that T. And then you again have a P without QRS and again a broad complex. So this broad complex again escape. And if you carefully look at this broad complex and just adjacent to it, you found a P. Isn't it? There is a small P just look with that QRS. And this P is certainly not related to that QRS. That P is generated by the sinus node by itself. And this QRS is generated by the ventricle separately. So that means this ECG is not complete heart block. It is intermittent complete heart block because you found narrow complex. And how you picked that? Apparently you are saying that this is complete heart block. How you picked that? When you applied those five principles. Everything is under those 5 principles. When you apply those 5 principles, you will find that this thing is not fitting in this condition. So certainly in that situation, you have to judge and found other thing. So, अब कोई